And welcome back, Rio Grande Guardian viewers. Today we're in Harlingen, Texas for an interview with the CEO of Valley Baptist Health System, Mr. Manny Vela. And the reason for the interview will be apparent later. But first of all, Manny, this is a story about yourself really, and your incredible public service to our region. But because you come from such a famous Valley family, tell us a little bit about that heritage.
Thank you for being here, and thanks for the kind words, Steve. We always appreciate the attention that you give in us and so many other entities throughout the Valley to spread the good word, so thank you for that. Yeah, I'm very proud of our heritage here in the Rio Grande Valley. My great-great-grandparents on my father's side crossed over from Mexico, from Mexico to be exact, in 1857. And so we've lived here in the Valley, probably within a 75 mile radius from here since that period of time. My grandfather was actually born at an old family ranch called the Laguna Seca Ranch, north of Edinburgh. And he moved to Harlingen sometime in the 1920s, sometime in that time frame. My dad was born here. My mom was actually born in Donna and raised in Port Isabel. And so our roots are really deep here in the Rio Grande Valley. We couldn't be more proud of our heritage and really all of the great things that we've been able to glean and learn from my parents and their parents, and through historical records and writings, their parents as well. And so we're blessed to be here. This is our community. We take that very seriously. And if you note the history of my family, many people have been involved in public service in one shape, form, or fashion. I went the private route, but many of my relatives have taken the public route through elective office and those kind of things. But probably most proud of just the importance of credibility and integrity as it relates to the family, the reputation, those kind of things. But also on the emphasis towards education. And education being a tool to improve and advance in our communities. And so many other things we could talk about. The other thing that comes to mind is the first orange tree in the Rio Grande Valley was raised at the Laguna Seca Ranch. There's a historical marker indicating the same. That's debatable for some people, but the marker is what it is. I'll let other folks debate if there were others earlier. But it's a very cool story, and it's something that we've always hung our hat on, so with pride.
And then let's talk about your education leading up to and becoming an attorney.
Yes. Yeah, I went to, started undergraduate school at Stephen F. Austin, went there for 2 years. And I guess let me back up just a hair. Graduated from Harlingen High School in 1981. So this school district has always been something special to me and remains to this day. My daughter's actually the public relations director for the school district. And so lots of good friends here. It's one of many phenomenal school districts throughout the Valley. I think we can all take great pride in that. So started my undergraduate experience at Stephen F. Austin, and I literally went to school thinking I was going to be some type of a park ranger or something dealing with outdoors, wildlife, those kind of things. And I laugh. I tell people the story all the time that as a freshman, one of the weed courses is botany. And about 2 weeks into botany, we started studying the life cycle of the acorn. And I immediately knew that might not be the direction I ultimately wanted to go in. So I backed up on what I was going to study, went to a general study type of situation or initiative, and ended up transferring to the University of Texas at Austin in 1983. Graduated from UT Austin in 1985. Went right into law school at UT Austin from 85 to 88. Graduated from law school. My wife graduated from pharmacy school simultaneously at UT Austin as well, and we moved back down to the Valley.
Mm-hmm. And so how long were you a practicing attorney, specializing in work as an attorney before moving into an executive role within healthcare?
Yeah, I had a general practice for 15 years. A lot of that time was with my dad in a Vela and Vela partnership, somewhat loose partnership, but a partnership. Enjoyed the experience very much. I mean, I got to see my dad every day. I almost was at the courthouse on a daily basis. I grin when I tell people I'm a reformed trial lawyer, and I say that with a grin because, quite honestly, being a lawyer is something I'm incredibly proud of. I've maintained my license. To this day, I don't ever have an intention of letting that license go. I worked hard for it. And the practice of the law can be extremely noble in and of itself, depending on what type of practice you have, what motivates you, etc. So I hold my colleagues with great esteem here in the Rio Grande Valley. They're phenomenal human beings, and I'm asked often, do you miss practicing law? And my response is not necessarily practicing law, but I miss being able to interact with my colleagues who practice law to this day, and had great experiences at the courthouse. The people fighting for justice every day there, and it was something I'm proud of that history. I tell people I wouldn't give up my trial experience for anything in the world. It helped me learn how to communicate better. I picked many juries, and that's an experience that I'll always treasure and value.
Mhm. And so, moving into the world of healthcare, that was not planned. I mean, tell us how that
Yeah.
came about.
Yeah, I'm smiling because the phrase I use is I tell people I backed in on healthcare, and thank God it's been the biggest blessing of my life from a professional perspective. I literally, right before I applied to become the general counsel here at Valley Baptist, I went home one day and I told my wife I want to redirect my practice. I had done criminal defense work to a large degree, including other type of general work, trial work. But I wanted to redirect that. And so, almost simultaneously, within 2 or 3 weeks of that conversation with my wife, I received a phone call from the then Valley Baptist CEO, Jim Springfield, let me know that they had opened a general counsel position. Valley Baptist had never had one. And he invited me to apply for that role. Later came to find out that a mutual friend of ours, Bill Elliff, is the one that planted that seed with him. Bill and I went to high school together and known each other a long time. And I thank Bill publicly for that because that's why we're here today. I was given that opportunity, but I applied for the general counsel position, went through the interview process, the first time I'd ever interviewed for a job in my life, and got the job. And I started on September 1st, 2003 as general counsel for Valley Baptist.
Mm-hmm. And what are your thoughts? What were you, when you think back, when you started as general counsel here, what was that like? How different was it all?
Yeah, it was completely different. I basically let Jim know I didn't have any corporate experience, definitely didn't have any healthcare experience. And his quote, almost to the word, was, "Don't worry, you're going to pick it up quickly, and we have outside counsel that helps us now and will continue helping us move forward." And he was absolutely right in regards to being able to draw from folks who were our outside counsel through the years. And absolutely, I thanked them recently because my tenure here has been incredibly favorable and positive to a large degree because of the help and support they gave me early on in my career in healthcare.
Mm. And so, how many years was it before you were asked to take over the reins fully and become the CEO of this system?
I took over as CEO for the system on March the 1st of 2012. We had completed our deal with Vanguard the August, early September the year before. And that was part of the transition from a wholly owned, not-for-profit, I should say, to Vanguard in Valley Baptist being in a partnership. Vanguard owned 51%, and the not-for-profit Valley Baptist maintained 49% ownership. That ended up changing within 2 years when Tenet purchased Vanguard, and then now we're wholly owned by Tenet. So I had been in my role as general counsel from September of 2003 to late February of 2012.
Mm-hmm. That was quite a lot of time, and then you become the CEO of the system in 2012. Here we are at the start of 2023. So you've been CEO here for 11 years.
I've been coming up on 11 years on March 1st, and then I've been the CEO for Valley Baptist Medical Center Harlingen. I don't remember the exact date on that one, but it's been about 5 years now. And so I went from having the role of system CEO to taking on the role of the Valley Baptist Medical Center Harlingen CEO as well. And I'll tell you without any hesitation, you hear it all the time, surround yourself with people that know more about you do in their area of expertise, and that's what I've done. Steve, I'm surrounded by incredible professionals, incredible human beings every day, all day long. I count my blessings. I mean, it's the old phrase, I get to work with heroes. Every day I come to work, and I've told people, and I made reference to this in my announcement last week. I don't believe I can be more professionally fulfilled than I am at this moment in my life because of the people I've been able to work with and because of the multitude of people we've been able to help.
Now, so you alluded there to an announcement, so perhaps at this stage I've got some specific questions about the world of healthcare and this system, but let's move on
Sure.
to that announcement.
Absolutely.
You have sent a memo to your staff.
Yes.
Saying,
Yeah, I sent a memo to my staff last Friday mid-morning that it's my intent to retire from healthcare from Valley Baptist Health System effective April 30th of this year. It was an emotional week, an emotionally charged week. After 19 plus years at Valley Baptist, you don't make those decisions lightly. And obviously in conferring with my wife and my children, who are the most important things in my life, they're significant others, determined that there was the right time to make this move. Noting that I've been here for that period of time, I've had the experience, I've had the blessing, as I referenced, to be able to work with the people I've been able to work with. I thought the time was right to make a move, to hopefully maintain my engagement here in our communities, but in another form or fashion. And definitely with a schedule that permits me to enjoy my wife's company and my family's company much more than I'm currently able to do so with my schedule. And so the message was a heartfelt one to my folks, letting them know how much I appreciate them, how much I admire them, how much I respect them, how much I brag about being part of the most incredible healthcare team in the world. I put this team against anybody in the world, Steve, from a healthcare perspective. And I tell people, I don't mean that arrogantly. I'm not suggesting we don't make mistakes. We're all human beings. But I will tell you in total confidence, what makes us the greatest healthcare team in the world is we always want to be better. We're going to make efforts to do that. We want to be the best, because that means we're offering the absolute highest quality of care in the best environment possible for our communities, and that's what drives us.
and so can I ask what's the reaction been? I mean, you've got a lot of team members that never wanted this day to happen.
Yeah, and I appreciate that. That's a huge compliment, and I take it to heart. And I've had just really heartfelt positive reaction from my folks, with one indicating they're going to miss me, and I'm going to miss them, obviously, but two, with a heartfelt hope and wish that I'm able to do what I've suggested I want to do, which is spend more time with my family. They also understand, and I made reference to this in the memo, I'm going to stay engaged in our communities. I'm driven by that. My family's driven by that. We've been so for a long time. And so in that regard, I want to do something that's going to have a direct impact on the health and well-being of our community down here as it relates to opportunities across the board. It just won't be in healthcare administration. But I'll look back on my 19 plus years here on my team with absolute affection for the rest of my life. I mean, I'm wearing my Valley Baptist shirt today. You'll see me wearing my Valley Baptist shirt in perpetuity. And every time I do so, I'll put it on with a great sense of pride of what we've been able to accomplish as a team, right? Because you've heard me say this, there's no silo in healthcare. There's no I in healthcare. There's nothing anybody does positively in this environment without a majorly team effort. And that's what we have here. We have a family. We have a Valley Baptist family that acts as a cohesive team in trying to accomplish what we've been trying to accomplish, or what we try to accomplish on a daily basis.
And the biggest challenge you've had and your team has had, and everyone in healthcare, was COVID-19.
Yes.
A life-changing experience for anyone in healthcare. Your thoughts now, a couple of years afterwards?
Yeah. The experience with COVID is something I hope nobody else ever has to experience. But I can tell you without hesitation that our system and all the other healthcare systems down here have come out of COVID much stronger than when we went in. you gain an experience in regards to crisis management. You have to learn by what you've experienced. What we know today is so much more advanced than when COVID hit in early 2020, and so from that perspective, an incredible learning experience. The tragedy, though, Steve, is not lost on me. Will never be lost on me. Many people lost their lives. However, I will say this, and before I leave from that thought, though, we're not going to forget those people that lost their lives due to COVID. And so for the families out there who lost loved ones, I lost friends, I lost loved ones, right? That we'll never forget. I will say this, though. We formed the strongest private-public partnership in Cameron County, more so than anybody else in the entire state. I'll say that with total confidence. Through the leadership of Judge Eddie Trevino and his team from the Health Department, emergency management folks, phenomenal leadership. They were the catalyst to gather a lot of different public entities or municipalities, but also bring together into the table private entities such as Valley Baptist and the other healthcare systems in Cameron County, along with our EMS responders in Cameron County and Willacy County, all at the table. Weekly phone calls to make sure strategically we were sharing our resources, sharing our information, sharing our data so that we could collectively try to defend our communities against COVID to the best of our abilities. And I can tell you without hesitation as well, we saved lives as a result of that strong partnership. I've had the opportunity to thank those other entities, starting with the county, multiple times in a public way, and I'll do so for the balance of my life, because if I'm proud of, if I had to list what I'm most proud of, that would definitely be on the list of being most proud of the partnership we formed and the impact we had as it related to fighting COVID in our communities. As I referenced, though, I hope we never have to go through this again. Chances are that we will, though. It's just the nature of the world. The world is flat these days. And so my hope is that if we ever have to go through this again, we can draw off of the experience that we've had. Dear Lord knows we're battle tested now in that regard, and be in a better position at the front end so that we can even mitigate the risk and the damage more significantly than this time. But to everybody who was involved from a healthcare provision perspective, or just involved in our communities collectively in that fight with us, thank you from the bottom of our hearts for everything you did to support my heroes here at Valley Baptist and all the other heroes that were working in the environment. I told people all the time, I get to sit in my office. I got to sit in my office during that time frame. I mean, there were long days, right? Long hours. I worked with my chief nursing officer at one point for 58 straight days during COVID, right? But that's nothing compared to the people that were on the front line, day in and day out, putting their lives on the line, right? I do give thanks to my home office, my tenant home office, for supplying us with the protective equipment we needed at that time. They never faltered in that regard. They were very supportive, and I think it deserves public recognition and thanks. And they've also been supportive of many other efforts, strategic efforts and other efforts that we make here at Valley Baptist that has allowed us to do our jobs in such a great way. And so I thank them for all of that support that we've received throughout my tenure, and would expect that support to continue after my transition.
Mm-hmm. So tell us a little bit about the system. What's your coverage area? How many staff do you have? How many patients do you see per year, for example?
We have our oldest hospital here in Brownsville, and I mean that from a historical perspective. 100 years in Brownsville this year. It's how long we've been serving that community. And we're right behind here in Harlingen, 99 years this year. We opened a micro hospital 2.5 years ago in Weslaco. Very proud of all of our facilities. I really am. We have leadership teams that are extraordinary in every single facility right now. Leslie Bingham's our CEO in Brownsville. Her team's phenomenal. We oversee Weslaco, so that's part of my administrative team here. These folks are phenomenal as well. They're extraordinary too. And we service pretty much the market area I would describe as all of Cameron County, Willacy County, and all the way over to the Mid-Valley, which is in that Donna area, north and south from there, all the way east to the coast, to the Gulf Coast, right? And obviously our southern border is the Rio Grande River. And so we service definitely well over 600,000, 800,000 folks. We help, I can't give you a specific number, I can tell you we help tens of thousands of people every year with their healthcare needs. And as I referenced, for 100 years in Brownsville, 99 here in Harlingen, and 2.5 at our micro. And I think we're positioned so incredibly well. We've got so much talent here at all our facilities. Folks can rest easy from a transition perspective. Valley Baptist is in phenomenal hands. I will leave on April 30th, starting on May 1st, with a confidence in the ability of Valley Baptist to serve our communities for 100 years more, or 100 years longer, if not longer than that too.
Yeah, so you've said quite a few times here you'd put your team up against anyone. You have a phenomenal team here at the system, and you're leaving the system in very good hands. But tell us about the healthcare industry in general. Yep. Here in the Rio Grande Valley, because I've often heard you talk about your concerns about the access to healthcare.
Yep. Yeah, it's a great question, and you've done such a good job for us in helping us get that word out. There's really two areas, I think, of concern. One that's been a concern for many years, and that's the lack of access to healthcare for so many of our residents. I tell folks all the time, listen, we're the number one in diabetes in the whole country, number one in obesity, we're number one in being medically uninsured, and you can tack on number one in health illiteracy as well. And when I say those things, obviously those aren't things to brag about. I say those things so people recognize the challenges that we face here as a community, right? And from the provision of healthcare perspective. And so what's happened over the years is when people don't have access to insurance, typically that means they don't have access to healthcare until they are acutely ill. And what's happened historically here in the Rio Grande Valley, and it's not just here at Valley Baptist, it's across the board, is people have had to use our emergency departments as primary care facilities. Or as I referenced, if they're more acutely ill, which is many times the case, they're so far down the road from an acuteness perspective that it becomes a health crisis by the time they get here. The value of having access to the care is being able to have a counseling from a primary care doctor, for instance, who will make sure that you're checking your blood sugar levels for diabetes. They'll check your weight. If you need other regimens or protocols in regards to medication, that they monitor all that stuff. But when people don't have access to that, the physical condition of folks can go downhill and deteriorate pretty quickly. And so that's what we see here is the overusage at times of our emergency departments because of lack of access to primary care. So what you've heard me say many times over the years is it's got to happen in Austin, Texas. It's got to happen with our leaders at the state level to understand that it is to a large degree a moral issue, right? These are people who don't have access to care. But it's an economic issue as well, because what happens by the time somebody comes to the emergency room and they're acutely ill, Steve, is the cost of that care is exponentially higher than it would had somebody been able to receive care through primary care access. And so, and what happens, and I've seen this before, it's sort of circular in regards to the cost, because our insurance costs and deductibles are related to the cost of caring for our uninsured in our communities, right? So that's why you've seen big business throughout the state of Texas. You've seen major chambers of commerce, major municipalities urge the state to do what's necessary to increase access to care. I don't even want to call it Medicaid expansion anymore, because that's like, you can't do that. It's a non-starter in Austin, and I've said I don't care what you call it, as long as the end result is creating additional access to care for our communities. And so that's one of our biggest challenges here in the Rio Grande Valley. It remains so because of a lack of desire to have that kind of conversation in Austin right now, or lack of movement. The other crisis is more immediate and has only been with us for a shorter term, but it's significant as well. And we're all facing a staffing crisis in healthcare in the Rio Grande Valley. I don't think it's siloed as it relates to healthcare. I know there are other industries that are struggling as well. But in healthcare, we started seeing a reduction in our workforce when COVID hit. First, there were people who just did not want to work in that environment, right? And I respect that, right? As I referenced earlier, it takes a special person to go day to day, day after day, on the floors with that risk in place. And so I understand that. Well, as COVID progressed, the state helped us significantly by sending us strike force personnel. We also had a military unit, 2 military units here at the moment we needed it the most, when the crisis was the largest. And so those things were all incredibly helpful, and I'm very appreciative for all of that help. But what happened was, between the losses that we initially established when COVID hit, and then you can fast forward multiple months through the crises, the agencies that provided the staffing support started hiring nurses and allied health professions from this area to go address the COVID crisis somewhere else. And once that happened, it was like a second sound of major percentages of our workforce in the Rio Grande Valley, hence to the point today where we're all definitely short-staffed across the board. Working as hard as we can to retain our folks, just by showing appreciation, etc., making sure we're being fair by them, but also in the recruitment of additional folks. And so I'll emphasize this: it's not just nursing shortages that are looming; it's allied health professions. But here at hospitals, it takes an army to support what our clinically trained folks do. So we're talking folks across the board: our engineering folks, our healthcare folks, even our finance and accounting folks, right? Case management folks. It's every facet of our workforce right now is something we're concentrating on because of those shortages. And I'm not alone in that. You can definitely go talk to my colleagues across the valley, and I'm sure across the state right now. You know, the statistics I've shown, we're just talking about doctors and nurses for just a few minutes, or that we're over 3,000 nurses short in the valley alone today, and that's projected to increase exponentially by 2030. Same with doctors, tens of thousands short right now across the country. And so I tell people, right now is our time to collectively gather our resources. Every single institution down here, an entity that has anything to do with training or those type of personnel, let's collaborate as strongly as we can. Let's listen to industry, understand what the needs are, and then work together to try to increase the pool of people available for all the myriad of jobs that we require in healthcare and beyond, right? And so I think we have a golden opportunity right now to work together in that regard. And there are a lot of institutions of higher learning down here doing just that. I applaud them for their efforts. We just need to continue working together to, like I said, to increase the pool of folks who can meet the demand, because as we stand here today, the demand is higher than the supply. It's that simple.
So you're going to be leaving at the end of April, as you say. We will have been well into the legislative session by then, which always ends at the end of May. So other than access to healthcare and staffing, are there any other issues you as a hospital, through the Association of Hospitals, are pushing for at the state level?
Sure. Yeah. One that we always try to help advocate for is supplemental payments that come to hospitals who have higher percentages of care for the uninsured and Medicaid populations. Obviously, if somebody's uninsured, it speaks for itself. They don't have insurance to cover the cost, et cetera. Medicaid pays probably right under 50 cents on the dollar, right? There are programs supported by the federal government that offer supplemental payments for the care we've provided historically or previously. And those are real important to hospitals up and down the river, all along the border, but also in other rural areas of Texas that meet that criteria, right? High levels of uninsured, high levels of Medicaid care, and the supplemental dollars that we receive for care that's been provided. I'll emphasize that. Vitally important for us to continue moving forward with what we're trying to do on a daily basis. So that would be up at the top of the list as well.
Mm-hmm. So probably I just have one more question, and then if I've missed anything, please feel free to add anything else you want to say. But how well do you work with? We've seen the expansion of the university, UT Rio Grande Valley, and the School of Medicine, and they've been opening clinics up and down the valley. How well do you work with them? How important are they as part of the overall picture? And also those smaller non-for-profit clinics that support this area.
First, I'm incredibly proud of the relationship we have with the UTRGV School of Medicine. Guy Bailey is a personal friend. I think he's done a great job Dr. Hawker is the dean now. He's doing a phenomenal job, consistently in communication with those gentlemen about efforts that we're trying to do collectively. I couldn't be more proud of the relationship, but I'm also incredibly impressed with what they've been able to do in a relatively short period of time as it relates to helping us provide the care we're trying to provide here in the Rio Grande Valley. Definitely wish them all the best of luck moving forward in that regard. I think anybody who contributes and participates in regards to strengthening healthcare, the support of healthcare in the Rio Grande Valley, it should be commended. And I'm talking about people who you would say, well, those are your competitors. I don't look at it that way. I really don't. And the reality is we're all in this together, right? And in regards to the other healthcare systems, I think we've made each other better by trying to be the first, by trying to be the best. And the folks that benefit the most when you do that happens to be our community, and that's who we're serving. So amen to all of that. But going back to the school and these other clinics that are opening up, they have the same goal we do. It's to take care of our community in the best way possible. So anybody who's making those efforts, let's go. Let's collaborate, let's communicate, let's do whatever we can on the resource side to help each other out, to better strengthen what is the healthcare network here in the Rio Grande Valley.
So Manny, is there anything I've missed out, anything else you want to add as we do this story about your career here?
Oh, Steve, thanks for the opportunity to share some of my heartfelt thoughts, and definitely important for me to get across how much I've loved working here, how much I enjoy working with the people here at Valley Baptist, helping our communities. As I referenced, I don't think I could be more fulfilled professionally. And I definitely personally want to thank my family too, right? My wife, my children, their significant others, my mom, my siblings. I mean, I have so many relatives here in the Rio Grande Valley, which is a joke sometimes because I have so many relatives in the Rio Grande Valley. But just a combination of looking back, understanding what I've been able to be a part of, feeling incredibly blessed for that. Just thank you to you, but also thank you to our community for having the confianza, the confidence to come seek care here at Valley Baptist. That's also an honor. Anytime we have that opportunity, it is truly an honor. That's not lost with my transition. That's the fabric and the foundation of this organization. I thank you. I thank every single member of my team here, my family as I've referenced them, and just thank you for the community for that confidence over all these years.
Well, Manny, thank you so much for the time you've given us today. As always, we've been very much well educated by this conversation. Thank you.
Thank you.